So one of the things that I think is important to remember if you're suffering in chronic pain, the process, the navigations, the exploring different options, all of that type of stuff, at the end of the day, it's your responsibility. And some people don't like to think like that. Some people want somebody else to make those decisions and do those things for them. And generally that's gonna fall on the provider, right? And so some people might think that if you have chronic pain, that it's the responsibility of your medical care provider to give you all of the options and explore everything with you. And unfortunately, that is not the case. That's not how a lot of this happens. And a lot of people end up finding what works for them by doing their own exploration and figuring out what works for them, what doesn't. Now, I'm not saying that the physician or healthcare provider should do nothing for you, because that's clearly not the case. We have to be careful to not get into this mindset that somebody else is going to figure this out for you. Somebody else is going to do the work. Somebody else is going to take it upon them to go down rabbit holes and figure everything else out. Because a lot of times healthcare practitioners are working with a lot of patients all at the same time. And so when I'm with a patient, as an example, the one-on-one interaction, like that has my full attention. But outside of that, when you've got a few hundred patients that you're taking care of, we can't be putting in 10, 20 hours a week looking at different options for patients. We can help teach and give tools and guides and ideas and things, and sometimes it's not enough. Sometimes we can't help people because we just don't have the time to provide that level of care for somebody because of the constraints within medicine in terms of how many people we're seeing and that type of stuff.